Facilitated positional release, T3 to T12. Diagnosis. Diagnose the thoracic spine using standard three-plane diagnostic approach. Setup. This technique is best performed with the patient seated. Ask the patient to sit comfortably on the edge of the table. Stand behind the patient or sit next to the patient. Adjust the table so that the patient's head is at or just below your eye or shoulder level. Contact of tissues. Monitoring hand. Contact the posterior transverse process of the dysfunctional segment and surrounding soft tissues. Gently layer palpate to the level of the transverse process to monitor for bony segmental motion. Operating hand. To create a sufficient activating force, two compressive forces will be aimed at the dysfunctional segment. One activating force comes from your hand and the other from the upper arm, axilla, on the patient's shoulders. Contact one shoulder with your hand and one with your upper arm or axilla. This is achieved by placing your arm anteriorly across the patient's shoulder and upper chest. This allows you to control both shoulders simultaneously. Application of principles. Monitoring hand. Maintain contact throughout entire procedure and palpate surrounding tissue texture changes and position of dysfunctional segment. Operating hand and arm. Ask the patient to sit up straight to flatten the thoracic spinal curvature. Hold this position with your hand and arms. Add a downward compressive force with both your hands and the shoulders directed diagonally to the dysfunctional segment just until it is felt at the monitoring hand. Tension in the surrounding paraspinal musculature should decrease slightly. Place this dysfunctional segment, using the shoulders as a long lever, in the position of somatic dysfunction in rotation and side bending. The monitoring hand should detect decreased tissue tension. Maintain this force for 3 to 5 seconds. Release the activating force. Return the dysfunctional segment and long lever to neutral position. Retest for somatic dysfunction of the thoracic spine.